Hey everyone, it's Dr. Ellie here with my podcast, I Heal Kids. And if you don't know me, I am a holistic pediatrician in Asheville, North Carolina, and I serve kiddos 0 to 21. So if you need any holistic pediatrics and you live in or around Asheville, definitely reach out. I also do functional medicine for kiddos ages 2 to 102. If you do not know what functional medicine is, please check out the other pods. I will link those in the show notes. And I would love to see you for that too. And today I am so excited. I am here with Jessica Mark, who is an amazing ortho-bionomist, which I am embarrassed to admit I did not know that existed before meeting Jessica. Welcome, Jessica.
Thank you. Thanks for having me.
You're so welcome. So you guys, Jessica is an advanced practitioner. She's an instructor of Ortho-Bionomy. She has 30 years of experience in movement, wellness, healing arts. Lucky for us, she's also based in Asheville, North Carolina, and she offers a private practice for clients of all ages. So I think zero to whatever.
Yeah,
Okay,
exactly.
Perfect.
Anyone.
Okay. Great. I love it. And Jessica's background is actually in a lot of things, and I'd love to know more about this. I don't actually know what this is. Polarity therapy, trauma therapy, which I do know, visceral manipulation that I do know, gyrokinesis that I could guess, but I might need more info, mind body centering, and infant development, as well as breastfeeding, which is amazing for us because that fits right into what I do. She also mentors students through the Ortho-Bionomy program in Asheville and offers an embodied holistic training both in person and online. And if you didn't know this, she's also, if you weren't accomplished enough, so a former professional modern dancer and retired Pilates instructor. And Jessica brings a deep love for movement, curiosity to everything that she does. And she lives with her wonderful husband, 2 kids, and is always on the search for the perfect biscuit recipe. Me too.
Very important. Very important.
Especially if I can find a good gluten-free one.
Totally. Exactly.
Yeah. So Jessica, you live here in the mountains of Western North Carolina with your husband and kids, like we talked about. But what inspired you to pursue a career in orthobionomy? Like, how did your personal experiences shape your path? How did you end up here? Because you started in dance, right?
Yeah, it's a great question. I have a pretty funny story about that. I was actually living in Philadelphia. I had a Pilates studio and was a dancer in Philadelphia for a number of years and New York area. And I was, burning the candle at both ends in terms of being a modern dancer and working in a dance studio, owning a Pilates studio. And I was getting a little burned out. I'm not going to lie. And so I was interested in learning something else in terms of some kind of bodywork therapy. I thought about massage therapy for about 2 minutes and I thought it's great, but I know I'm going to burn out in that. And I really was looking for something that empowered my clients and not just having me be the fixer to them. And so I actually researched and was looking at craniosacral therapy for a while. And I think that's a beautiful technique, but that technique led me to a website. This was back when the internet was a baby. And so there was not very much information on anything anywhere, and led me to a school in New Mexico that offered this thing called Ortho-Bionomy. And when I'd heard about it, I was like, I thought I've heard of everything because I'd studied dance and movement and kinesiology and anatomy and really aware of lots of different bodywork therapies. And I never heard of Ortho-Bionomy. And so that led me, the curiosity just led me to Santa Fe. And I took my first week-long class in it, and I was hooked from the word hello. And I think I was hooked because the principles of the work, I felt like they were how I wanted to live my life. So I felt like what was happening on the micro or the cellular part of our bodies was a mirror to nature and how the cosmos worked and how we function in relationship to the world. And so it really made sense to me. It spoke truth to me. And so I kept studying, and I'm still 20 years later continuing to learn. And I feel like I've just scratched the surface on the beauty of this work. So that's kind of how I found it. Most people find it because they experienced it and they had a session, but I knew nothing about it going in, and I've just never left since then.
Yeah, I think it's so interesting. So many of us either have an experience that leads us down a path, or we start down a totally different path and kind of end up somewhere else, like me starting out in totally conventional medicine and being like, let me put the brakes on this because this is not the path that I want to continue down. Not that I want to always exclude, Western medicine. My journey is to combine, but yeah, it's fascinating when you're like, I had no idea. I really didn't. I grew up in a small area in Missouri. I had I knew there were osteopaths. I knew there were MDs. I had no idea there were naturopaths. I didn't even know there were acupuncturists. So when I got out of school,
So
I was
different.
very surprised. Yeah. And just came to it in a completely different way and was like, it was just like mind blowing, kind of like your experience where you ended up in Santa Fe. So, for parents that are new to this approach, like, how do you explain how orthobionomy differs? I know you mentioned kind of like the microcellular level and all of that. I think most people are probably familiar with kind of massage and maybe craniosacral. But where does orthobionomy sort of slot into all of the different types of body work?
So orthobionomy is very gentle. That is one thing that sets it apart from a lot of different body works. There are some that are gentle as well, but we are very non-invasive, and the kind of focus of orthobionomy is to help elicit your own body's natural self-corrective reflexes. And so a lot of times when our bodies get into patterns, we sort of forget, the brain kind of forgets that they're in that pattern. That leads to either chronic pain or stress or imbalances in the body, which can set up a whole host of other issues. And so what orthobionomy does is it really shows the body what it's doing, shows the brain what it's doing, and opens up other possibilities of creating ease, creating balance, and really creating adaptability. So I like to say that we have a broad brushstroke in terms of how to keep the body moving efficiently. One of our osteopathic principles that we bring with us from osteopathy is the rule of the artery is supreme. And that's a lot of words to say, if there's flow in the body, then the body has the best chance possible of being efficient in its communication. And when things can communicate easily, there is more effortlessness in the body, and everything can happen with a lot more ease. And so that's what we try to do, is listen for where those imbalances are and what system they may be coming from, or what system might be able to respond to create a different sense of flow or ease, or linking up different things, because it's all in relationship. It's all in connection and collaboration together to create these vital organisms that we live in that are ever changing, right? Different needs for different times in our lives, different things that we're doing in our life.
Yeah. And to put like, or maybe it's not a fine point, maybe it's just another point. We had talked previously, and you were sort of explaining it to me because I was getting to know your work. And a piece that I found really interesting is you were telling me a story, and I think it was maybe of the founder of Ortho-Bionomy, and how he had a patient who had back pain and was put in like a very easeful position and was able to recover. And that was kind of the root of Ortho-Bionomy, sort of finding how the body can heal itself. Am I getting that right, or was there
Yeah.
more to the story?
No, that's very
Yeah.
close. That actually was a osteopath in the US named Dr. Lawrence Jones. And he had the patient who came in, crazy back pain. The guy couldn't sleep, he couldn't eat, and he was just miserable for many weeks. The doctor really didn't know what to do. He tried everything. So finally the guy said, "Could you please just get me comfortable?" And the doctor obliged and put him on a table, brought in a bunch of pillows, and he fell asleep or he rested there for maybe 20 or 30 minutes. The doctor left the room to check on other patients, and then came back, and the man was standing upright for the first time in many weeks. And so the doctor luckily was like, "What just happened here?" And he reverse engineered this process of realizing that if we soften around the joint, if we bring the joint into a shortened position, those proprioceptors inside the joint can reorganize, really, and get a message that they can self-correct from within and come back to a balanced state. And that's really what happened. And so Arthur Lincoln Pauls, who was the osteopathic doctor who read that paper about that study, he found that idea intriguing. And so he began to play with that shortening, which the shortening is now called strain counter strain, that Dr. Jones developed, which a lot of physical therapists use as well. And he said, "I wonder if we can have this process happen in like less than 90 seconds." And he continued to explore, and he realized that a tiny bit of light compression into the joint helps stimulate those proprioceptors to provide a reflex, a release in less than 20 seconds. And so that's really where his work began to change from the strain counter strain. And then he added in lots of different reflexes that the body can do. You know, in craniosacral, there's a lot of following of the body, following the fluids, and how that really can promote more flow and ease. In orthobionomy, we also work with like what happens when that flow is a repetitive pattern. And can we help the body recognize again that it has more choices and more ways to integrate that patterning into the body where it's more efficient? So it's to me, we start to work where like, okay, where there's a structural piece to our work, there's also a more fluid or soft tissue piece to our work, and there's also an energetic component. And all of that is wrapped into we're tracking the body's ability to respond. Can the brain and the body and the enteric nervous system and the heart really sync up to feel like we can have some choices to be more calm, restful, at ease in our own bodies? And that to me is the beauty of the work.
Yeah. And just for those of people that may not know, proprioceptor, it's basically like an organ that receives sensory info and helps relate it back to the body. So that's what we're talking about there is like, what is the sensation and how is the body relating to it and responding to it? So we kind of work with that a little bit in osteopathy too, which is amazing and just helping everything kind of relax and release and reset. And to your point, the body wants to heal. And so, how can we support the body to heal? And also, to your point, this is kind of like, work with like people that are having chronic pain. It may not be okay. So, why is this pain stimulus there? It's there to alert us so that we can make a change so that we can get better. However, in some people, that pain stimulus remains for whatever reason that may be illness, cancer, God forbid, anything like that. And so, how can we help the body accept that the pain is there and then find some ease around it? And I think this really complements a lot of the work that I do in functional medicine and also with mind body technique. So, breath work, relaxation, techniques like progressive muscle relaxation, yoga, therapy, all of that. That said, what are some common issues that families, especially children, since that's where what most people come to me for, although I say parents, see parents too. But what are these families facing and what are the issues that orthobionomy can help address?
Babies and children are kind of near and dear to my heart because the work is so quick with them because they just have these beautiful nervous systems that are receptive and ready to receive and integrate the little bit of suggestions that we give. So orthobionomy really can help to me on a physical level where we have bumps and bruises and strains and playground mishaps and a knee got tweaked this way in gymnastics class and things like that that may not resolve easily. We also can help with more chronic issues. Like sometimes I see kids or teenagers with chronic headaches. So whether it's a hormonal issue or stress, or again, just holding in the nervous system in general, sometimes that's helpful. And then on the more emotional side of things, orthobionomy again helps the body regulate with more ease. And so anything from anxiety and depression, emotional anger outbursts, things that I see a lot of kids with sensory processing issues or difficulties. It's like, how do we help the body come back into a state of recognition of all of the parts of me can be involved in this communication, in this daily life, instead of sometimes I feel like we get, off onto one end of the spectrum and it's hard to tether ourselves back into more of this grounded state. Orthobionomy helps support that. And then also, I think developmentally, I see some kids with maybe crawling as a little late in the game, or we talk about how it's so important to go through those developmental stages. It doesn't matter necessarily how long we spend in those stages, but that we pass through them. So getting some of those back online, sometimes it has to do with a birth trauma or just a difficult birth of the baby's way that their brain and body are struggling with this kind of past, energy in the body and how to help bring it up to this present moment in order to get that, like, oh, I can use the full capacity of my whole body to do all wonderful things that kids do and do it with ease and be able to have that adaptability in our world these days. So a lot of different issues that we work with. Yeah. In terms of infants, there's so much with breastfeeding issues and latching and sleep difficulties, gastrointestinal things, flathead, torticollis. So a lot of times I see babies and usually we know within 2 sessions if this is something that is helpful for an infant because it's so quick for them. It's really fun to see. Yeah.
Yeah, I do feel I've had that experience also. The infants seem to unwind so quickly.
Right? It's so fun to watch them.
and just almost melt in your fingers,
Yeah.
and you're like, okay.
Yeah.
I know you do also some work around tongue tie too. I know that's a big topic today. Do you want to talk about that a little bit and how this can help with that?
Yeah, I mean, I still feel like I'm learning so much just in terms of how different modalities treat tongue tie. And so, in terms of the orthobionomy scope, I think that there are times when tongue tie surgery is definitely necessary, but there's certain osteopaths that really think that it's more of the positioning of the palate and working with those upper cervical spine and getting the cranial bones really in sync and organized and having the most amount of flow and ease to be able to have the best use of the tongue functioning as possible. And so that's really our scope, is that we are sometimes it's like it's less about, the actual tongue and more about the tongue's relationship in the mouth and with those upper cervicals and the nerves that run through here in terms of the latching a reflex to come online. And so sometimes just unwinding part of their spine and working with their cranium sets that up, that patterning up to have much more ease. And then they get it. It's so fun to see it come online like, oh, I can do that. Yeah. My neck tension is not in the way anymore. So that's kind of our scope, that we work from that physiological place of, can we line everything up, right? And get the best. And then it's like, oh yeah, then surgery may be necessary after that, if we're not getting the results that we need to.
Yeah, I think unless there's like a dire, a baby is losing a ton of weight and we're getting into like a complex medical concern, I think there can be time to do some body work first, whether it's, orthobionomy or OT or feeding. There's plenty of different workers that kind of do this work. And then, we can take the next steps because, I guess I'm kind of a little biased. I'm of the mind, like, what can we do more gently? And then progress. That said, to your point, there's always nuance. If there's a dire medical circumstance, sometimes we have to
Exactly.
step in sooner. So I want to switch gears just for a minute because I know parents are dying to know because parents are like exhausted. It's emotionally demanding. It's like, what kind of help can we offer parents? How can we support them? How does orthobionomy help parents maintain their health and well-being? When should they come and see you? I think like yesterday, but I'll let you answer the
Right.
question.
Well, what I love about this work is that it shouldn't be something that you become dependent on. I mean, it's a great addition to your preventative health care if that resonates with you. Other people, people do all kinds of things for their preventative health care. So it's kind of like try it, see how your body feels. But just in terms of the short term, I think that parents, we get so externally focused on the children, because we have to, because we are trying to help them grow and be healthy and make good choices and all of those wonderful things that we do as parents. And we forget to pay attention on the inside to our own bodies. And so that's a big piece of, just step one, like simple things like as you take in your morning beverage, can you take 5 seconds to really smell the scent of that beverage, to really feel your digestive system for a moment, and to take that sip and feel the warm liquid or whatever it is kind of entering into your body. It's like, I always like to help parents say, or find those ways that work for them to find comfort, to come back in, to recognize there is my support, or there I can find a little moment of an exhale, a little moment of some more ease. Because when we're not listening to our bodies, that's when things start to creep in and then they start to get louder. And then suddenly we're in a big mess that's going to take a long time to unwind from. So finding those moments of like just sitting on the park bench, watching your kids on the playground, maybe it's like, can I take some deep breaths here? Can I feel the air around me? Can I look at the trees, the sky? Can I remember my connection back into my own body? And then, I think that there's little things that we can do in terms of some of these we do all the time. Like, am I comfortable here? How can I get more comfortable, right? Whether someone is breastfeeding or you're carrying a child, or even if you're driving your kids around town, can I make this seat a little bit more comfortable? My shoulders, I feel a lot of tension in my shoulders. Maybe in orthobionomy, what we do is we exaggerate that tension pattern. So you could do this with me if you wanted to, is just squeeze your shoulders up by your ears and feel that tension build a little bit. You might be holding your breath. You could even scrunch your face in a little bit, feel that tension, and then see if you can feel a little bit of the crest of the wave where you're like, I can't hold this any longer. and let that go. And then do a little bit of, wiggling around and just feel how, oh, okay, that maybe it didn't solve all your tension of your shoulders, but maybe there's a little bit of volume decrease, a little bit of softening in your body that you can return back to like, oh, right, I have some things I can listen to as well as my children.
Yeah, 100%. And, I have never ignored symptoms and let them get out of control.
Right? Are you human? Right. Totally. We all do it. It's natural.
Yeah.
Yeah.
Yeah, and it's so important for I love to just acknowledge like whether we're a wellness practitioners or not, we all have moments where like the health spiral, I call it the spiral because I feel like it's never going to be like no one has achieved the nirvana of well-being, maybe the Buddha.
All right. But he
I don't
doesn't have
know.
children running around. And
Yeah. Jesus, I'm not sure.
right.
There's probably a couple of people, but
Yeah.
most of us have not achieved like 100% well-being, 100% mental health at all times because we all have like incoming inputs and stressors and things like that. And really, whether you're a parent, you're a person that supports parents, you are living in the world, I think to your point, just even being able to have set moments. And that's kind of what I've come to is instead of like waiting for, I don't know if this resonates for you at all, but instead of waiting for things to kind of get past my zone of tolerance where I'm like, my back hurts and I'm irritable and I don't want to make this phone call. And all I want to do is grab some sugar.
Totally.
Right.
Been there.
Yeah. 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 Been
Yeah.
there.
Right.
So it's like, what are the trigger points that make you stop before that happens? And that seems to work well for me, just having like built in moments. I will tell you, mine are red lights. And when I work on the computer, doing like computer charting tasks that I don't like super enjoy. And I always try to do like just a 2-minute breath work practice because that tends to keep me level. Am I perfect? No, but in general. And I imagine like with Ortho-Bionomy, like some of the bodywork techniques, that might be a helpful kind of moment, like what you're saying too. It's like, oh, well, you always have this morning drink. So like, why not bring it in there versus like having someone build in like a 1 hour practice that they may not even have time for because they have 3 kids under 2.
Yeah,
You're like,
exactly. It's not
yeah.
possible. It really is not. Yeah. No, just resonating with you of like, how do we put those little pieces in? Because that to me is sustainability, right? I think we're all searching for this like balance place. And so it's always like, okay, if I get this schedule right, or if I get the kids to school, as soon as they're out of the house, then to school, then I'll be better. As soon as I do this other job shift thing, then my life will be better. And yes, that can be true. And to me, it's like that also takes us out of the present moment. And how do we remember that balance is the key to balance is actually movement and fluidity and recognizing I've got to tweak a little few things here for this to flow more easily. And then I can get back to this for this to flow more easily. And that's what I feel like Ortho-Bionomy supports is our ability to find that flow and to be able to manage the stress and let it move through us as opposed to like girding up, pulling up our bootstraps a little bit more to muster through. That to me is where we get into trouble down the road because we do that enough times and it does creates havoc on the body.
Yeah, I mean, it reminds me of kind of like yoga, like when you do, if anyone's a yoga or yogini, is it a yogini? I never can get that
Yeah.
right. Yogi.
One of
If you
those.
do
Yeah.
like, yeah, if you do like that tree pose where you stand with like your one leg against the other leg and you like put your arms up, like if you try to hold, like lock it in, it seems like you're going to fall over. But if you just kind of like go with it, like your body's like, okay, cool. We're just kind of like bounced around. I guess that's fine. So I did want to ask you, because I think this is like an important point. I'm sure there's like a bunch of misconceptions, as there are about almost everything in the world,
Yep.
especially today. So what are some common like misconceptions about orthobionomy, like that you encounter? Like how would you address them? What would you tell people?
Misconception is a funny thing because a lot of times people don't find me until they've tried everything else before and then they're just desperate, right? And like a lot of times I hear like, oh, I wish I knew that this was an option to try. But I think that the main piece I get is like, oh, wow, I didn't know that the body could release so easily. or I didn't know that like it looks like you're doing nothing. So sometimes it looks like I'm just holding. And it's like, how could that possibly even do anything? It's a paradigm shift because we're in a culture right now that we think we need force, we need big things to happen, we need no pain, no gain kind of mentality. And so this really turns all of that on its head. And it also calls up the wisdom in our own bodies, which we're not used to paying attention to. We're used to handing over our, these are the data about my body. So you, more wise person, tell me what's wrong with me. Instead of those foundational steps of like, something feels a little off. What do I need to do? Can my body heal it itself or fix it itself? If not, how do I ask for external support to get some more eyes and ears and brains on this to help me understand what I may need to do to heal? So I think those are the little pieces of like, how can this be so gentle and so subtle and create such vast changes in the body?
Yeah, this sort of reminds me of like in functional medicine when people come in and I'm like, okay, just so you know, this is soft and slow and gentle, and you're going to feel better, and it's not going to be tomorrow. That's a little different than orthobionomy. But I will say, I think we're so used to this world of like, again, there are places for surgery and medications, in my opinion. Do I want to start with those at all times? No, unless it's an emergency. But we're so used to like, you've got to do something. You have to do something big, dramatic, maybe painful, and possibly with side effects so that you know that it's working.
Right, exactly.
Right. It's like, okay, we've got a head cold. Let's make sure that we're taking amoxicillin with clavulanic acid, and our kids are going to get diarrhea most likely. Their
Yeah,
gut microbiome is going to get mixed up, but we're doing something.
right,
Right.
exactly.
And I think it's a definite paradigm shift to be like, oh, actually, we can do some really gentle dietary stuff. We can take a step back and look at our schedules, even our ergonomic setup. To your point, like you may be I've actually heard the story. You may be working at your standing desk if you have one and you're lucky enough to be privileged enough to own one. And you may not be wearing socks and you're irritable because your feet are cold and you haven't even been that, aware enough.
Yeah,
Right. So there's all these things. But just making sure that people understand like soft and gentle does not mean ineffective,
that's right.
right?
Yeah,
Same with like when I do like a little bit of body work on the babies, it's like it looks like, to your point, nothing.
right.
And so you're like, well,
I know. I'm like, I promise I'm doing something.
yeah, yeah, but
Yeah,
you can feel it.
absolutely. Yeah.
Yeah. I also teach, some gentle techniques for parents to do at home. And then over time, they learn it too. And they're like, oh, I did feel that. And so it just takes a little bit of practice. I'm
It's
not
like
going to have
another
someone.
language, you know? It's like I feel like on those subtle levels, we're listening to what's underneath. It's like getting to the root of the issue. And that just takes practice and the ability to have some patience to listen to those different signals. Yeah,
Yeah, 100%.
that's
Yeah,
great.
I love that. I love that you're such a resource for this because I do so much in a visit. I can do a little bit of osteopathic work, but really for like the full, for a full session, it requires either
Mhm.
a second set of eyes or another session because it's too much to do, with everything else that I do.
Time that you have. Yep, exactly.
Yeah. I know that you shared a little story about daily routines, but I just wanted to go back to that and kind of look at it a little bit more granular way. With parents in particular, let's say parents with kids under age 3, just because I think that's most where every stage is hard, but I think that stage in particular, there's less self sufficiency with kids. There's more that you're like hands on doing, whether
Yeah.
it's,
You're a little more
toileting
in
and
survival
yeah,
mode at that point, right?
yeah. What are some other gentle practices like parents could do related to your work?
So one principle of orthobionomy is that we soften around tenderness. So again, a lot of times when we feel tenderness in the neck, we might want to like stretch it out or try to massage it out, which can feel definitely good in the moment. In terms of just to your point of like that feedback loop, sometimes I think it gives the tissues there a different sensation, so it kind of interrupts that feedback loop. But if you want to do this little self care with me and find just a little bit of tenderness in your neck and kind of demonstrating it, but you can really do this anywhere in your body. So if you find a tenderness, or maybe it's like a little tight spot, or just a spot where you feel like is a little offline, maybe. And then you put your fingers at that spot and then use any movements of your head. Now, remember, we're always working with comfort. So if any of this is painful at all, we're going to steer away from that painful area and move towards the ease. And see if you can find the place where your head comes into a position that really softens that point. So then there's two options here. You could just pause here and hang out for about 30 seconds. And the other option is to take your opposite hand and give the top of your head a tiny bit of compression. So it's really like the weight of your hand and maybe just a little bit more. We're not trying to override anything. We're simply trying to show the body what it's doing. And then you can hold that for maybe 10 or 12 seconds. Or sometimes people will feel like, oh, I've had enough of that. I want to come out of that. And release your hand from your head. Maybe do a little head movement to integrate that. And then just recheck that point and see if there's any more softness or if that tenderness has dissipated a little bit. And you can do that really anywhere in the body that you feel like a tenderness, kind of what are ways that we can soften around that point and hang out. And generally that brings a sense of ease, a sense of comfort to the system, and the body can begin to self-correct from there. So that's just one little self-care technique that sometimes we use to help the body remind it of its ability to be adaptable and find that response from within.
Yeah, I love that. I mean, I can definitely feel I did that little activity with you, and I can definitely feel a release. And I will tell you, I am one that is like, get out the Theragun, get an elbow in there.
Get after it.
Yeah,
Totally.
my fiery pit of personality is
Right.
like, knock that knot out.
Yeah.
But to your point, it's like, oh, okay, like just let it release. Like you don't need to beat your body up. Okay, so that's super. So when people come and see you, I'm certain you're going to teach them some of those techniques they can do at home as well as what you do in the office. Do you want to maybe just share just to kind of highlight like what people can expect when they come to see you, like a memorable success story, maybe something that made a difference for a kid or a parent? That way when people come in, they kind of know what to expect, or like how it might be different from some other techniques, or like what they would do. Like, are you naked? Like,
Right.
how do you
Right.
show up for an
The basics.
ortho-bionomy appointment?
Yeah, exactly.
Yes. Yeah.
Yes. All your clothes are on, no clothes come off, maybe shoes come off. And depending on the age of the kid and what the kind of focus of the session is, I work with kids so differently. So infants, again, I'll work with them in their arms. Sometimes I'll work with infants while they're breastfeeding. Again, it's so nurturing in terms of the baby feels safe. I can do cranial work or different work with their gastrointestinal system while they're nursing. So the main piece is like, how can we help the kid feel comfortable? Some kids have had body work before, or they know the deal and they're excited to jump up on the table and lie very still. Others want to bounce around the room. And so we do different games together. It's a lot of sensory processing, kind of integrative games with them, and help the parents work with the parents on what can we do at home? Because it's not just about coming here. It's really less about that. And it's more about me witnessing how the child or the infant moves and how their nervous system is taking in the world. That helps me understand then what the parents can do at home to create some more ease. And then sometimes we have a back and forth, like, well, this worked and this didn't work. And so then we brainstorm about other ideas to try. So it really does look differently. A lot of times I'll have a conversation with parents beforehand, just so that they, depending on the age of the kid, we can work together with the kid to say what this is so that they feel comfortable, right? A lot of kids may have had some poking and prodding and different doctor's visits before. And so one more appointment where somebody does that is really not going to be something they're interested in doing. And so we talk together about how to help them understand that this is a different modality. Sometimes when I talk to kids, I say, I remind them that these are my only tools, these hands here. I don't use any other tools in my practice. And the most important thing is that they're comfortable, and they need to let me know if they're not. And I try to help them understand that my hands are kind of like magic hands, and they can really feel and sense different things happening in their body from within. And I'm kind of like the street sweeper. I kind of like, there are things that can accumulate in our bodies that, like, oh, we forgot to take the trash out, or there's a lot of gunk in the creek or in the roadway. And so I come through and I make sure that that trash and that debris is cleared out so your body can run and jump and skip and frolic all to its heart's desire and do all kinds of things that, wonderfully agile kid bodies can do.
I love that, and glad we don't have to, like, strip down to do some
No,
orthobionomy,
none of that. Not in my scope of
and
practice.
yeah. It's nice to just feel a little more comfy, sometimes you
Yes.
go to some of those, like, doctor visits and you're like, "Can I get out of this gown now?" This is a weird question, and I don't know the answer to it, but given that this is a hands-on modality, could you ever do work over Zoom with a parent? Like maybe someone that's been coming for a while or has a kiddo that either has mobility issues that would make it difficult or sensory that would make it difficult to come in? Is that something
Absolutely.
you
And
offer?
and a lot of times I can hear about the kid and hear about different circumstances or different issues that they're having at home. And so sometimes it's not even necessarily that the child has to be on Zoom at all. And I can have consultations with parents about like, okay, let's try this and let's try this, and just helping them understand their bodies, their kids' bodies a little bit differently, right? Like sometimes there's like an imbalance in the electromagnetic communication or relationship. And some kids with sensory processing may have a lot more on the electrical side. And so, how to work with them to feel like, okay, can I get their bodies to sense their magnetism a little bit more, which can bring it more into balance. So, yes, I also do that as well.
Okay, that's amazing. So for everyone who's super excited to work with you for right now, what are like the first steps to get started with you for parents that are interested either for themselves or their kids? And then also like where can people find you?
My website's very easy. It's orthobionomy.net. So ortho means correct, bio means life, and nami means the study of. So it's kind of the correct application of the natural laws of life is how that name came about. It's a mouthful, but orthobionomy.net. And there's all kinds of information there and ways to schedule there. And then my social Instagram and Facebook is orthobionomy AVL for Asheville. AVL.
Cute.
Yeah,
And for all of y'all who are like, Bionomy, what? How do you spell that? Bionomy. And ortho is ORTHO. So orthobionomy.net.
you got it.
I always have that issue with integrative. I don't know. I think it's like one of those like
Yeah.
like how do you spell it? Anyway. Well, thank you so much
Oh,
for
it's been
being
a
here.
pleasure. Yes.
Yeah. Any last thoughts that you want to share with listeners that you want to conclude with? Or
No,
should
I
we
think,
just leave it there and
yeah,
chat
we
again
covered,
another time?
I know
Okay.
there could be so much more, right? But we covered so much. I'm just grateful for this opportunity and grateful to let people know that there's another choice in terms of helping our bodies regulate and find ease and comfort from within.
Lovely. Well, I love that. Well, Jessica and I are wishing you guys well. And again, I'm Dr. Ellie with Middle Path Integrated Pediatrics. So reach out if you need any holistic pediatrics between 0 and 21 or functional medicine 2 to 102. Bye, guys.
Thanks so much, Ellie.